new patient comes into this intensive care unit in Juarez Hospital, Mexico City. In this old war hospital from the 19th century, the staff are heading into a new battle. The enemy this time round leaves few survivors once patients are unable to breathe for themselves. An exhausted nurse, Julio, 32, has struggled to come to terms with that.
The toughest thing is your mental state, because you put in all of your effort, but the patients still don't survive. In my shifts, I've seen very few of them get better.
Staff here have been going non-stop since the start of the pandemic, and although the country's health system has coped so far, the capital's hospitals have approached max capacity, even as Mexico starts to go back to work. Are you worried about the reopening of the country and what that might bring?
Más que preocupado, decepcionado, ¿no? Porque
I'm more disappointed than worried because they say there's less patients and the curve is flattening now, but we don't know that. We could not have even reached the peak because for us there's been no decrease in the number of patients.
The number of infected and the dead nationwide has surged, and in Mexico a worrying pattern is also emerging. Just had a quick check around this intensive care unit, and one thing that really strikes you is that everyone is under the age of 60 here, and that's a real change in the trend from Europe, for example, when it seemed like the more elderly were the most at risk. There's a reason. 70% of Mexican adults are obese due to a junk food habit unmatched in the rest of Latin America, and 1 in 7 have diabetes. It makes Mexicans of all ages vulnerable to COVID. And even in this hospital, one of the best equipped, staff lack the basic medicine to treat them.
There's still some antibiotics that we need and that we don't have, so we have to talk to the family members to buy them. And it means a delay, but we don't have another option.
Many other Mexican hospitals are in a worse state, with staff across the country protesting about a lack of gear and training. Perhaps because of that, doctors and nurses are getting infected at one of the highest rates in the world. With that grim panorama, every success story is celebrated. And Aurelio, a gas salesman, is one of them. He was being discharged on the day of our visit. Although still fairly sick, nothing was going to stop him getting out. How are you feeling now you're about to leave?
I feel really excited. That's why I'm coughing.
While he enjoys his freedom once more, the team in the intensive care unit continue their struggle. With the images that you're allowing us to broadcast, what do you hope that this achieves?
We want people to be aware that this is getting worse. For people who say that COVID-19 doesn't exist, to know that here on the front lines, we're seeing it for ourselves. We don't eat for 8 hours, we don't drink water, we're giving our best, but we need people to support us.
This team knows that in Mexico, this still might be just the beginning. John Holman, Al Jazeera, Mexico City.